talk about what can cause low back pain in women. Lower back pain is a very common problem in society nowadays, and everybody has suffered, mostly everybody has suffered from lower back pain at some or the other point of time in their life. Now, there are some specific conditions that can lead to low back pain, especially in women. So, we're going to discuss that today in the video. Now, before I go further, for those of you who don't know me, my name is Swati. I'm an executive mom power coach. So, I help moms of younger children who work in high stress executive jobs manage the physical aches and pains that come with motherhood. Now, this could be starting from your pregnancy to childbirth to the younger baby days or the toddler stage or even younger kids, right? So, as mums, we go through a lot of aches and pains during these stages of our lives. And sometimes, because we are busy, these get brushed under the carpet. And, or maybe, hey, you are one of those moms who's tried everything. And you tried everything for your back pain or your neck pain, your joint pain, and nothing has really helped. So, this is where I come in and I help you with simple strategies, easy tips, and I guide you along how to avoid these aches and pains. And I'm referring to simple things like back pain, neck pain, heel pain, a poor posture, a weak pelvic floor. However, these simple things can sometimes just stop you in your tracks. So I help you so that you can be a better mom, you can be more active with your children, and you can be more productive at work rather than just thinking about that pain that is sitting in the background all the time. All right, so going back to our topic for today, what can cause lower back pain or back pain in women? So, the very first one is spinal fractures due to osteoporosis. Now, because as women, we have a certain set of hormones that are acting on our body. I mean, men also do, but let's just look at women now. So, as women, we have these certain set of hormones that are acting on. Oops, sorry about that. That was my phone. So we have a certain set of hormones that are acting on our body, and when you are approaching menopause, so just pre-menopause or during menopause, your estrogen levels go down drastically compared to what they were before. Estrogen has a protective function when it comes to your bone density. So, if your estrogen levels are low, then your bone density tends to go down more rapidly. And because your bones are not dense enough, they are more prone to fractures or breaks and cracks, right? Now, it does not mean that every woman who is going through menopause will get a fracture, but this is one of the probable and most common cause of spinal fractures and, of course, then low back pain or back pain. Now, I'm just looking at my notes here. Yeah, the second one is back pain due to endometriosis. Now, this is a gynecological problem. So, I'm not going to go into the details. I'm sure you must have heard about it. So, with endometriosis, what happens is you tend to get this severe pain that goes into your pelvic area and into your genital area, and it can also, and it does most probably, come to your lower back as well. So sometimes you are looking for other causes of back pain, but actually it is the endometriosis that is causing this back pain. So one of the tips here is it does feel like period pain. So when you have your menstruation, especially, you will get this low back pain. All right. So the third one is pain in your tailbone, that is coccydynia. So this is the medical term that's used. However, you can just say tailbone pain. Now, men and women tend to have a different shape of their pelvis because obviously the women, they were meant anatomically to have a fetus which has to fit into that pelvis, and obviously the passage for the childbirth as well. And so that's like the lower part of your pelvis there. So there is a difference in the shape of the tailbone when it comes to men and women, and the angle at which your pelvis is sitting is also different for men and women. And just these anatomical differences make women more prone to tailbone pain or coccydynia. Now, the fourth and final one that I'm going to talk about is sacroiliac joint pain. Now, sacroiliac joints are basically the joint between your pelvis and your lower back. So, if you trace your spine down, you will where it joins, you will see the lower back, sorry, the lumbar spine joins the pelvis, that is the ring of bone around your lower between your abdomen and your thighs. That ring of bone where it joins the lower back at the very lower part of your spine, on either side of the spine, that is your sacroiliac joints. So you have one on the left and one on the right. Now, what happens is during your pregnancy, as you are coming towards the end of your pregnancy, there is a hormone secreted which is known as relaxin. Now, the function of this hormone is to relax the body, right? So, what it does is it relaxes specifically especially the ligaments around your pelvis, so that the pelvis can expand with the growing fetus, and then it can also expand during childbirth, right? So the lower outlet of the pelvis can expand comfortably. Now, because of this relaxin, the effect on the sacroiliac joints is sometimes it can lead to a bit of instability around your SIJ or the sacroiliac joints. So you might have come across this lower back pain on either side of your spine, where your physical therapist or your doctor has given you a SIJ belt that is worn slightly below where you would tie the belt of your trousers. So that area has to be supported with this belt. It's like a lumbar corset or a lumbar belt. So when you have SIJ pain, that can also cause this lower back pain. Now, some women get it even after they have delivered their baby. They will still have, after the childbirth, they will still have this pain, and it can continue on in the later years as well. So these are the four very common conditions that women tend to have a lower back pain with. So first was your osteoporosis in your spine, second is endometriosis, then is tailbone, that is coccydynia pain, and the fourth one is your SIJ or sacroiliac joint pain. So I hope that gave you a little bit of insight about the types of low back pain that can occur in women. So it's not just your spine and ligaments and the local area. Sometimes these pains are coming from different structures in and around your lower back pain and your pelvis as well. Alrighty, so if you have any questions or if there are any topics that you want me to cover in my videos, do leave a comment under this video and I'll pick it up from there. If you're looking for more information, simple explanations, or easy tips to manage your spinal, that is your back and neck pain, or even your joint pain, you can join my free community. I will leave a link in the description of this video. If you're watching me on Instagram, the link is in my bio. There is a link there. So when you click on it, it'll take you to another page. And as you scroll down, you will see my community. Alrighty, I'll see you guys next time. And I hope that was helpful. Bye for now.